Then some people noticed, and when my first paper appeared, I got a letter from a Nobel laureate saying this is the biggest discovery since relativity. If you are in the United States, stop by. That was the letter. What is there? What is that spot there? Can you smell it? Can you touch it? Can you feel it?
Right.
Can you taste it?
Yeah.
Nothing. So we are all constantly living in a world. We are making up this weird thing called space. We feel it's there. But we can't touch it. We can't feel it. It's just immovable. It's there. And our brain is actually creating that concept of space on the fly.
You know, that's always been interesting, and certainly we can go down a rabbit hole on this. But
Yeah.
I do want to state that I've always been curious as to the reality of the world around us,
Yeah.
right? So like how I see things is so influenced by, like, there's so many factors influencing the reality around me in the sense
Right.
of like my interpretation of all these sensory inputs.
That's right.
Right? How that's processed in my brain, and then my actions relative to those sensory inputs or the prediction of those sensory inputs.
That's exactly right.
Right? There's like so many factors
That's
involved.
exactly right.
Right? And then considering all those factors involved, it's like, okay, well, if all those factors are involved, then certainly my reality can be completely different
That's right.
from your reality.
Absolutely.
Right? Especially
That's right.
all the intricacies of the actual brain.
Yeah.
Right? You have trillions of neurons, you have all these axons, everything like that. To expect that everyone's brain is similar,
Yeah.
and would process those sensory inputs and would predict what those sensory inputs are going to do and what those actions should be based off of those sensory inputs.
Yeah.
Right? It's crazy to think that
Isn't
my
it?
reality would be
That's
the same
right.
as yours, right?
That's exactly right. And I can
that's
prove to
interesting.
you right now that when you are behaving in space, you think that you're behaving based on what you're seeing. No, actually, the space that you're behaving in is entirely made up, must be made up. So I'm going to prove to you. Want to do an experiment?
Yeah, for sure.
All right. So imagine I'm close enough to you,
Okay.
and I'm going to simply move my hand in front of you.
Okay.
And as soon as I say go, you're going to lift your hand and catch it.
Okay. You want me to catch your
Easy.
hand?
Yeah. So say go. You did it.
Right.
Now, let's think through that. Slow this down, the whole process. What did you do?
Okay.
The way the brain works is that any given moment when the hand is here, the light, reflected light from
Right.
here goes into the retina,
Right.
goes through 17 processing stages of the brain, goes to your motor cortex, gives a command called go, goes through your spinal cord, goes to your arms, activates the muscle, and you move.
Right.
Now, even when you're doing this really fast, when your life depends on it,
Yeah.
it'll take about quarter of a second. That's how long it takes before you can
Right.
actually react.
Yeah.
In quarter of a second, even at this lowly speed,
Mm-hmm.
my hand would have moved by 25 centimeters, at 1 meter per second.
Right.
You should have gone here. You didn't go here.
Right. Based off of my sensory input at that
You
moment.
calculated.
Right.
Your brain calculated where my hand is going to land.
It predicted where your hand was
Predicted.
going to be.
That's exactly right.
But what was that prediction based off of? It was
Based on all sorts of things.
all sorts of things.
It sounds like the
including-
prediction was based entirely on this, but no. For example, if you were standing right now, and you'll be able to do this too, and if you were standing and you lifted your hand to catch my hand, you'll fall on your face.
Right.
Because you're like an unstable system, you'll kind of fall on your face
Yeah.
due to gravity.
Yeah.
So you already calculated how much will your center of gravity shift.
Right.
You pulled your body backwards.
Right.
You did all sorts of things. You figured out the wind resistance. You figured out whether you have a backpack or not. Based on that, you lean forward or
Right.
backward by a different amount. So your brain is calculating these things that we take for granted all the time. And at the same time, let's say if you're at your home and you're kind of sleepy and you smell bacon. Now, imagine you have a huge home.
Right.
And you're in your bedroom and you smell bacon. You think, wait, this is not right. It should be in the kitchen. What the hell?
Mm-hmm.
Here, hopefully, if you're a meat eater,
Yeah.
that's a pleasant smell.
Right. Like you don't walk to
Yeah.
you don't walk to the bathroom because you're smelling bacon.
That's right. That's right. So our brain is making up.
Right.
Even our human brain is making up a concept of space based on all kinds of things. Sounds. If you hear a little bit of water dripping and you're in your bedroom, you're going to freak out.
Right.
If you're in the shower and water drips, you say, yeah, it's all
It's
good.
supposed to be. Right.
So it is a weird thing which we can change
Right.
based on demand.
I haven't even introduced you yet.
We can go backwards.
This is the UCLA BrainSPORT podcast. I'm always excited before every episode, but I'm particularly excited with this guest that we have today, Dr. Mayank Mehta, the director of the Keck Neuro-physics program, right? Center. And I think today we're going to talk about virtual reality and the benefits and potential pitfalls of virtual reality. I think that's a conversation we need to have. And I think it's an important conversation considering how digital our entire world is getting, right?
And how meta is getting.
Is that your go-to joke?
That's my go-to joke. I'll use it a million times. I didn't do it. Mark Zuckerberg did it, so why not?
Yeah, that's true. You might as well piggyback off of that. So, let's just start off with, how virtual reality actually works. Are you able to just start at a foundational sort of level like that, and we can go from there?
Yeah. So let's think about what is so special about virtual reality, and how is it different? Let's start with something that we all know. How is it different from television? We all used to television or your cell phone, you watch something. So how is virtual reality different? In fact, many times you watch your cell phone in the VR goggles. So why is it different? The main difference, if I were to put it succinctly, is that virtual reality is where the world that you see reacts to your movements. Television too reacts if you change the screen, but that's too slow. It takes you several seconds to change the channel button or the volume button and so on. You can look away from the TV screen and the screen will go away, but that's also like the real world.
Right.
I can be looking at you and I can move my head and I see something else.
Yeah.
Those are the things that our brain is used to. In fact, back in the day from caveman could change channels, right? A caveman or cavewoman will be sitting in a cave. It's raining outside and they can see a giraffe walking by and they can look to the left and they can see the fire or the kids playing. And there's nothing wrong. There's nothing strange about it. It's a strange thing that I just changed my head and the view is completely different. But our body has built an elaborate system to deal with it. To deal with the fact that at this moment there was a giraffe and I moved my head and all of a sudden there is a child.
Yeah.
Our brain through evolution has dealt with it. How do we know that? Let's go ahead and take a look at an infant. One of the first games a 1-year-old will play is to go behind a curtain and come out. Mm-hmm. They find it funny that somebody just disappeared and reappeared. Yeah. And through decade or so of training, we learned this is all fine. We also learned even more interesting thing that if I walked one step, right now, let's say I moved my head forward, the whole visual scene came at me. Yeah. And that's good. That's fine. But if I didn't move my head and the scene came at me, I'll duck. Say, whoops, things are falling.
So what you're doing, what it sounds like, you're comparing virtual reality to just our own reality and how our brain works.
That's exactly right. So when we perceive these things around us, our brain is calculating how much of the change in the world that you see is due to the changes you, the actor, did. Mm-hmm. And how much was the reaction of the world. Or something happened in the world, such as you didn't do anything and something moved on its own. Right. Now, when we put on virtual reality goggles of any kind, we developed a really fancy one, but let's start with the simple one that's commercially available. So you put on the goggles and now what happens? That you're sitting somewhere and you move some cursor or the other because you're not going forward anywhere. You can move your head to the left and right, but that's about it. You're now going to go forward in VR games somewhere, but your body says, nope, you're not going anywhere. You're sitting there. There's no acceleration. There's no wind going by. Right. There's no smells that are changing along with it.
Right.
So your brain now has to solve a different problem that it has never solved before. We are going back to infancy. Infants, as we discussed, learn how to say that this is the same thing. I just looked away and so on, and how much did I move and how much did the world change? Now our brain has to learn a new map of the world, which is very fast. Not unlike I change the channel that takes several seconds. It's like every step, every 100 milliseconds, every blink of an eye, I may turn to the left or right or forward. And at that point, my brain gets conflicting signals. Right. Some part of my brain says, no, you're not moved anywhere. Look, I feel the same chair. Mm-hmm. but the visual scene says you're going forward.
Right.
So your brain has to learn this new map. Now, that's what potentially makes virtual reality virtual. So we can ask ourselves, right? So if I watch virtual reality, why is virtual reality virtual?
Mm-hmm.
How does the brain know that virtual reality is virtual and not real?
Can I answer that question?
Yeah.
Because of these contradictory
Exactly.
sensory inputs,
That's right.
i.e., let's say if it's just a visual,
That's exactly right.
right? So let's say you're in virtual reality just visually, but you're in reality.
That's right.
You know, you're hearing reality. Your balance is in reality versus in
That's right.
the digital context or a virtual
That's
context,
right.
right? So your brain, through processing that, I'm sure you know a
Right.
lot better than I do, it's like, hey, no, all these other things are telling me that I'm outside, that I'm actually in reality, not in this sort of
That's exactly
contradictory visual stimuli.
right. That's exactly right.
Right.
So that's right. So this, if we agree on this simple idea, which
Mhm.
you put it very well, so I'm just going to agree with you. So if I were to agree with this idea, it starts to explain a hell of a lot of interesting things. So as we were discussing before we started, that the reality that we perceive is not just reality that you hear and see and smell and touch. Your brain is actually predicting what the reality is going to be.
Right.
And that's what you're really acting upon.
Right.
Such as when I move my head forward, my brain has predicted how much should the visual stimuli change.
Right.
And if it doesn't change by even small amount, then I know something else is moving or something is wrong and I should duck.
Right.
Or maybe when I'm driving, if another car moved by a different amount, maybe I should swerve. So
Right.
we are doing this really complex calculations using these things. It's not just input comes in and we just perceive
And
it.
we react.
We don't just
Yeah.
react. The reaction has to be already planned in
Right.
advance.
Right.
So our brain is learning these new rules of neurophysics.
Mm-hmm.
The rules of physics are that everything is consistent with some differences. Sound travels slower. The light travels faster. Our brain is okay with the sound and light distance. The air travels even slower. Our brain has learned all that through this and we are okay. So now when we are in virtual reality, those relationships are being changed. Your brain has to really learn these things. That is both good and bad. And we just started to look into that. And that's where the story got really interesting.
Mm-hmm.
So here we are talking about virtual reality for gaming or entertainment or for defense. For example, these drone operators, they are essentially sitting in VR, or a surgeon who is doing surgeries remotely.
Mm-hmm.
So let's think about what is really going on. Where in the brain is the space of virtual space being perceived?
Mm-hmm.
That space is about that big, more or less at the center of the brain. It's called hippocampus. It's an area discovered long time ago. It's very unique. If you take a brain scan, it sticks out like a thumb,
Yeah.
literally, not a sore one.
Yeah.
And
Ideally not.
ideally
Yeah.
not. Now, in that part of the brain, people know. And that part of the brain is really mysterious for many reasons. And I'm going to go through a couple of them very quickly. If for a very short period of time I lost oxygen, the first part of the brain that gets damaged is hippocampus.
Mm-hmm.
Because there is a very high density of cells.
Right.
High density takes a lot of energy,
Mhm.
gets damaged. Concussion gets damaged. Stroke, one of the first places to get damaged is hippocampus. Moving further on, instead of kind of accidental causes to long-term causes, Alzheimer's disease starts in hippocampus.
Right.
Epilepsy, some of the worst forms of epilepsy which are intractable, are based in temporal lobe or hippocampus. Depression, schizophrenia, so very diverse. PTSD, somebody has a bad experience and they keep remembering that event. It's partly based on hippocampus.
Right.
So the question becomes, why is hippocampus involved in so many different things? Alzheimer's may be one gene, but then autism spectrum, completely different gene. Epilepsy, yet another different gene.
Mm-hmm.
So why are so many things going on in hippocampus? And this was discovered about 50 years ago, maybe 60 years ago, when there was a patient who had intractable epilepsy, and they had to remove that part of hippocampus so that the seizures
The
don't
seizure will
spread.
stop. Yeah.
What happened when they removed this part of hippocampus is that patient could no longer form new memories.
Right.
and that patient would start getting lost in space.
Mm-hmm.
So
What does lost in space mean?
meaning
Like it's spatial awareness?
spatial awareness,
Right.
and this is, it happens to all of us all the time. I
Mhm.
can wake up in the morning and I say, where are my keys? God damn it.
Right.
I kept them here.
Right.
Somebody must have moved it.
Right.
I just didn't remember it right. I had kept them somewhere else.
Yeah, yeah.
So we forget things. We remember things well, but we also forget things that we think in space. The where did I put something and so on. And similarly, in a slightly more advanced stages of Alzheimer's, not the lowest, but slightly one of the earliest symptoms, is that patients, they leave their work on the way to home,
Right.
and they get off at the wrong station, and they're confused. Something they have done many, many times.
Right.
So these scientists realize that we want to cure Alzheimer's for sure, and all these other diseases too. Epilepsy we want to cure, or we want to cure PTSD and so on. Now, once you want to cure these diseases, people develop drugs, all kinds of medications, and those medications are tested on animals first.
Mm-hmm.
Much as I don't like it, that is right now the only way to do it.
Mm-hmm.
How do I test a drug in an animal? By asking, do you have PTSD? I can't ask a rat or a mouse to say, do you have PTSD? I don't really know.
It's difficult to actually interpret neuropsychiatric behaviors and consequences in
That's
animal
right.
models.
So
right?
people actually focused on this quite a lot. And this brings us to virtual reality
Mhm.
directly. And let me go through what people did and where we are going.
Sure.
Because this thing has promised to actually cure Alzheimer's.
Okay.
Virtual reality shows promise to cure Alzheimer's.
Okay.
This is a big deal.
Yeah.
I'm making very strong claim.
Okay.
But let's go through it.
Is this the first time you make that claim, or you've been making?
No,
that
we
claim?
have been
Okay.
quoted in BBC and so
Oh,
on.
awesome.
Yeah,
Yeah,
this
yeah.
and several publications.
Okay.
I'm not just making it up on the show. I'm making it.
Right.
So, all right. So let's get started. So this part of the hippocampus, when hippocampus gets damaged, the subjects not only have deficits in memory, such as what was in a conversation or what did I have for lunch,
Right.
but they also get lost in space.
Yeah.
And as we were discussing before we started, that while animals have very different preferences and likes and dislikes, and they'll have different genetics and experiences, all animals must agree on space and time 100%. Because when creatures are interacting with each other, such as a bird is flying from pole to pole, and there is a fish underwater, and the bird has to catch that fish, if the bird and the fish's perception of exactly where each other is, despite different experience, gene pool, different medium, different laws of physics, different ways in which light travels,
Right.
if they didn't agree on it, the bird will never catch a fish.
Right.
Or the bird will get too many fish, and then there won't be any fish left.
Right.
So all creatures in the world must agree on space-time. So while I cannot ask a rat, what did you have for lunch? Are you feeling good? I can kind of guess, but I won't know. If I were to ask a rat, how well do you remember where is certain place?
Yeah.
That's something I can ask an Alzheimer's patient or an autistic patient or something, and then I can make it more interesting and challenging.
Right.
So that's the task that people have used for now 60 years.
Right.
So the task they have used is, so they take a mouse and to figure out, now the mice are smart. They're smarter than us. If you put a mouse on a table and say, go to a certain spot, they're going to leave scent marks on the table.
Mm-hmm.
They're going to cheat.
They're going to leave scent marks?
Yeah, they'll leave scent marks. So for example, let's say I asked you, hey, Daniel, I want to check how well your memory is working.
Right. Oh, they'll leave like little markers so that they know that.
That's
yeah,
right.
Okay.
They can smith. Their nose is right next to the ground.
Okay.
So if I were to ask you, go to that unmarked location right there in this room with an accuracy of 20 centimeters, you're going to have a hard time. You'll go more or less there.
Right.
But you won't go exactly there.
Yeah.
Because it's hard. It's
Yeah.
a hard thing, especially if the room is large and the area is small.
Yeah.
Mice can do it very well. People figure out because they leave damn scent marks. Because
Okay.
nose is right there. They
Right.
can sniff it. They can pick out this tiny texture on
Right,
the
right.
ground. So scientists were also smart. They said, let's solve this problem. So
Yeah.
what they did is they took a tank of water and make the water cold. And they put the mouse in it. And unknown to the mouse, underneath the table water level, there's a little pillar. So if he gets onto it, he escapes and doesn't have to swim.
Mm-hmm.
Some mice were still smart. They just chilled out. So now,
Literally in the cold water.
literally
Yeah.
chilled out. No pina colada, but without that, they're still having a good time.
Yeah.
So now the water has to be made cold. So
Okay.
it is uncomfortable.
Okay.
Then these mice rush and they escape the platform.
Okay.
And then they tested Alzheimer's drugs on these mice. And they were genetically modified mice in which they tested the Alzheimer's drugs. And these mice, lo and behold, got better. They were able to escape this thing as better than they would if they had the brain damage to hippocampus. So this task to say find that unmarked location in space that normal animals can do, that mice with Alzheimer's disease cannot do.
Right.
If you give them the drug, they can do better.
Right. So you're testing their spatial awareness to figure out where that escape mechanism is. You're not testing memory. Like it's not like they've done it before.
There's a little bit of memory too. You have a little bit of memory because in the first trial, when the mouse goes to the hidden platform, it takes him quite some time. It swims around all over the place, but based on going back and forth and so on, it can remember, say, oh, I went left and right and center. Now I don't need to do left and right. I just need to, that's a shortcut there.
Right.
The technique called path integration and cognitive mapping.
Yeah.
So I figure out I have to go roughly based on these two landmarks. Somewhere there I need to go from here and so on. So they are doing a complicated calculation, which is not only creating a perception of space, but they are also finding distances. Right. They're doing very funky calculations. So if I'm here, I need to turn right, then I need to go straight and so on. Now, so far so good. So then you say, hey, why, if all scientists have figured out all these things, why haven't we cured Alzheimer's in humans? You just told me that mice can do this task after taking this drug.
Yeah.
Turns out, not just one, but maybe a dozen Alzheimer's drugs developed by major corporations like Pfizer and so on, they worked in mice. When they gave it to humans, there was no improvement.
Yeah, human translatability. I think there's a bunch of controversy. I'm sure you know about like the Alzheimer's drugs out there, right?
That's
where
right.
You know, basically it just targets decreasing
A beta or tau.
Tau protein.
Two
or
different
A-beta.
ones. That's
and
right.
it certainly is able to do that, but there's no clinical translation.
That's right.
To those, right?
And
meaning it doesn't improve their
in
lack of spatial awareness or
exactly right.
memory issues.
That's
right?
exactly right.
Okay.
So this is where we come into picture.
Yeah.
This is where we began.
Yeah.
So about literally 10 years ago, I was studying this. As I said, I'm just a physicist studying the brain and how neurons talk to each other and how they predict. And I started to get interested in this. And I realized, again, like we were discussing before, that the nature of space that we perceive is different based on the nature of experience we have. For example, when this mouse is going to the hidden platform, why is the mouse going to that platform? Because it's afraid. It's drowning.
Right.
When a patient comes to a doctor and said, hey, doctor, I don't know why I came here. I forgot. Probably a memory problem.
Right.
But the patient doesn't want to recall horrible memories.
Right.
The patient wants to remember positive memories, most likely, such as what did I have for lunch? There's nobody who's going to come to a doctor and say, I can't remember any nasty things in my life. Don't change it. Leave it that way. And we know that the brain circuits for fear is very different. It's amygdala.
Right.
That's very strongly involved in fear. The brain circuits for seeking rewards, for seeking enjoyment are quite different. Hippocampus is common to both of them, that is true, but hippocampus gets input from all these centers. So we thought, is it possible that if we tested hippocampus in a positive experiment, positive experience experiment, we may get different answer. So we thought, what if one major reason why so many drugs, and it's not just about Alzheimer's, it's also about epilepsy. So many drugs in phase 1 trials, they work for animals. Phase 3 trials, super expensive. You don't want to give it to human beings, something that doesn't work. Doesn't work. What we thought, let's just do one simple thing. We test mice in the same condition as humans. Positive conditions and the same test, not a different test. So we can build VR for humans. In fact, we built a VR that is very cool for humans. They don't get dizzy. For example, one difficulty with commonly available VR,
which is a big problem that I've been hearing with VR.
That's right.
Because what makes you dizzy potentially is your vestibular system.
Exactly.
Right?
It's the prediction thing. When you move your head, your brain expects the world to move, the visual scene to change within a short period,
Exactly.
tens of milliseconds.
Right.
If that 10, 20 millisecond it doesn't move, that short delay
Right.
makes us dizzy.
And it seems like this is a big issue having to be overcome with the development of virtual reality, more
Right.
integrated virtual
Right.
reality systems, is the fact that how do we
Yeah.
put all those different
That's right.
sensory input systems into virtual
That's
reality, right? Like how do you put
That's
your inner
right.
ear into virtual reality?
That's right.
Right?
So
I'm sorry, go ahead.
That's
Yeah.
right. No,
Yeah, yeah.
absolutely. Thank you. So this is exactly the ideas we had.
Okay.
And that's where I went to the Keck Foundation 10 years ago
Yeah.
and said, we have this idea. If we did this, it'll be interesting. And they trusted us. The first problem we want to solve was we don't want to start with something which we already know has problems,
Right.
such as dizziness.
Okay.
Can we make a better VR? And the short answer is we have. We have made a VR in which there is no vestibular organ problem. Zero. There is zero latency. So all the gamers who might be listening, in our VR, there is no latency. We have done some trickery
Right.
using physics and so on.
Right.
So there is zero latency. You move your head in VR by small amount or fast amount, you will see exactly what your brain expects to see. No latency. It's a
Okay.
long story.
Right.
But
I don't want to go down that rabbit hole, but is it just a matter of the latency of the actual
No.
VR visual system, or
It's a
are
whole
you
different
actually
design.
addressing the vestibular
it's a different
system?
design.
Okay, we'll talk about that
Totally
later.
different
Yeah,
design.
we can talk about that
Ground
later.
up. That's right.
Right.
Not only that, there is another problem with the existing VR systems. In the current VR systems, you don't see your hands and legs.
Yeah.
You don't see your body. You
Right.
don't see your shadow. And there are several approaches that are coming up where you put some sensor in your hand and you move it, but then it's hard to grab something. People are working on it. In our VR, we have solved that problem too. In our VR, you see your entire shadow. You see your hand. When you walk through the forest in the VR, you will see the leaves and the shadows moving across your hands and body.
Which is really important. I'm sorry to interrupt you again
Please.
because what I've seen,
Yeah.
right, is in the potential benefits of VR in either mental health issues or societal issues.
Yeah.
The big selling point is the embodiment
Exactly.
concept in
That's
VR, right, where you can
Exactly.
actually, whether it's like a body dysmorphia or
That's
like
exactly
a, where you think that regardless of whether you lose weight or not, you're still
Yeah.
you still feel that you're overweight, right?
That's right. That's
If you
right.
can get put into VR in sort of a realistic concept
That's
and
right.
be able to actually see yourself in a positive light,
That's exactly
then
right.
that could potentially change your body dysmorphia.
Absolutely.
Another example I think that I really came across that was really cool is I think it was Stanford that did an experiment where they put people via virtual reality into an African American child. Did you hear about this? Where they put
I don't know this.
yeah, they put people into a virtual reality where they're an African American, right? And they put them through life undergoing these sort of racist racist situations,
Yeah.
right? And having that sort of embodiment
Yeah.
and the realistic nature of that embodiment potentially can increase empathy
That's
for other
right.
people's situations.
That's right. That's
And I
right.
think they even tested them like after 6 months, and they showed increased empathy. I don't know exactly how they
Very
tested
cool.
it, but
Very cool, yeah.
that's just kind of
Yeah,
like
no,
the
that's
importance
awesome.
of making
Yeah.
sure that we're able to embody people in a realistic fashion. I'm sorry, go ahead.
No, that's exactly right. So we want to get into all those interesting things about subjective natures of things as well.
Right.
Because who we are by definition subjective.
Yeah.
So here, this VR is completely immersive.
Yeah.
So not only that, we wanted to check whether the rat or the mouse actually likes the VR or not. Because if it's an aversive experience already, who knows? We are once again testing a whole different kind of experiment and different brain circuit. I want to test happy memories.
Right.
So what we do is that we give them a little bit of sugared water whenever they are in VR.
Hold on. So I think you glossed over this, which is like pretty incredible. The fact that you made a virtual reality set for a mouse.
That's right. And it's a happy place. There is no dizziness. There is full embodiment.
Right.
They can see their own body. They can feel stuff going by and so
Right
on.
now, I think this is a good place to just superimpose this video I think you have.
Yeah.
You brought it, but
We
it's
can
not worth
give it-
actually
yeah.
stopping and doing all that. We'll
Yeah.
just superimpose it on the video
Yeah.
of the actual virtual reality set
Yeah.
and the mouse going through
That's right.
and actually seeking out. I think you put breadcrumbs in the virtual reality.
Just drops of sugar water.
Drops of sugar water, sorry.
because we wanted to mimic human being behavior.
Right.
Human beings typically, when they watch TV or something, they sip wine or they
Right.
sip
Right,
soda
right.
or something. We can't give them wine, but
Yeah.
we can give them soda.
Right. Right.
Ideally beer, but
Yeah.
can give that too.
Some IPAs for the mice.
Something.
No. So I'm sorry. Yeah. Go ahead.
Yeah,
I don't want to gloss over that.
No, this
Yeah.
is absolutely, you're right. So we checked then. So they are immersed. There is zero dizziness because there is no latency. We created a fancy room in which we shut out the external world. Double steel walls. There are no experimenters in the room. There is zero distraction. So the reality is not kind of messed up, right? You're putting VR goggles and somebody's talking next to you outside.
Right.
It messes up those things.
Right.
We eliminated those things.
Yeah.
$1 million. We built this.
Is that how much we spent
That's
on it?
right. We wanted to test it really well. So we did physics style work, where you
Yeah.
remove random stuff,
Yeah.
100%. It's a clean experiment.
Yeah.
And then we wanted to compare because we are now able to ask a fundamental question. What is reality? So we made this as compelling as possible. And then for the same mice in the neighboring room with the same double steel walls and everything, we made a real world maze as well, which looked just like the virtual maze.
Okay.
Zero difference.
Okay.
Now we can start asking one after the other foundational questions that we take for granted.
Right.
Can the mouse's brain tell apart this maze is virtual, even though it's as immersive as real world, almost as immersive,
Right.
and there is no dizziness? Can his brain tell apart? So we put a bunch of fine electrodes in his brain. These electrodes, of course, we had to do special things.
Like EEG.
No, much
EEG record?
fancier.
Okay.
These electrodes are like 10 to 50 times thinner than human hair.
Okay.
And we anesthetize the animal so
Mm-hmm.
they don't feel any pain. And brain, as we know, doesn't feel pain anyway.
Mm-hmm.
And we thread this electrode, very fine electrode, more or less the size of a neuron. We place them between neurons, and then the electrode stays there, like some human patients with deep brain electrodes. There are right now 100,000 human beings, did you know, which had deep brain electrodes in their brains.
Yeah.
So we now listen.
DBS you're talking about, right? For
100,000
Parkinson's.
human beings. So
Yeah.
this mice has like some of those.
Right.
Now they can walk around, and then we monitored what they do. So the same rewards, the same visual cues, the same neurons, same mouse. They walk around in the real world maze. They walk in virtual maze. That's when the world started to change majorly.
Mm-hmm.
So the first difference we found, we can measure the activity of hundreds of neurons, not just one or two, because the electrodes are staying
Right,
between the
right, right.
neurons. We can listen into hundreds of individual ones.
Right.
So the classic textbook idea was that, well, virtual maze is just a cleaner maze. Now it's immersive. Now there is zero latency. You should see the same maps of space in this part of the brain. As I mentioned, this part of the brain codes for space.
Right.
It should do the same thing. Did not happen. Back in 2013, we found that 60% of neurons in this part of the very delicate part of the brain, hippocampus, shut down in virtual reality.
Okay.
That's a whopping shutdown.
It shuts down.
They
during
just
virtual
they don't
reality.
act. They are just not active.
And
They're
what was the preclinical or behavioral translation of that? Did they not
They
move?
didn't show anything. No,
Did
none.
they know it was virtual reality?
Nah, that's that great question. So as far as behavior is concerned, showed no effect.
Okay.
They're just running around in VR. That they really like to play around in VR.
Yeah.
We put some chandeliers on top,
Yeah.
and they stand up and try to touch the chandeliers with their nose
Yeah.
as if it's real, but
Right.
there's nothing.
Right.
So we give them soda water. They're drinking it, sugared water, not fizzy, and so on. And they're doing everything in VR, seemingly enjoying it.
Right.
In fact, the way we put them in VR is we put a little harness around them like a tuxedo.
Yeah.
So I always joke about it. Our mice wear a tuxedo and nothing else.
Yeah. They're fancy.
They're very fancy.
Yeah.
And they just run around here, and they even take naps in VR.
Okay.
And when they take naps in VR, which we know is where memory consolidation is supposed to happen,
Mm-hmm.
is underneath those places where they got the reward, even though the
Okay.
place is equally comfortable and smelly.
Right.
So even though they did all the natural things that they do in the real world, where they go and take a nap, where they get the reward, they like to go to the reward or sugared water and
Right.
so on, 60% of neurons simply shut down. You take
In the
them
hippocampus.
out in the hippocampus.
Right.
You take out the mice and put them in the real world, those neurons are back.
Right.
Now, this was only one experiment.
Okay.
And we know that 60% of neurons shutting down in hippocampus is a big deal.
Yeah.
So, for example, there are two major diseases in which hippocampus is overactive, as we call hyperactive. One disease is epilepsy. We know there is excessive excitatory neurons activity, and that leads to epileptic seizures. So we need to calm down the hippocampal activity. People have developed many drugs, but at the end, you give a drug, it goes all over the brain, can do other weird things, can be dangerous. Person can die if you shut down the neurons too much.
Right.
Here, I can put a mouse and on command, I can turn off only hippocampal neurons and mouse is fine.
Right.
So that's a huge deal. Another disease is Alzheimer's. Alzheimer's disease too, hippocampal activity goes hyperactive.
Okay.
Here, potentially, we can shut down the hippocampus as long as the patients are in VR. We can shut down the hippocampal activity. That can be a potential therapy.
But do you think that Alzheimer's disease, it's secondary, like the underlying pathophysiology or underlying issue is secondary to hyperactivity of the hippocampus?
Not really.
In a neurodegenerative condition, meaning you're losing neurons?
It's not. And I'm going to come to that.
Sorry.
Great question. Yeah. Great segue. So we're going to come to that. So that's absolutely right. Because Alzheimer's disease, other things happen. A-beta accumulation, tau pathology, and eventually there is this memory problems and so on. We have found a way to intervene somewhere in between and shut down the neurons. Now, is that really a good thing? Is that a therapy? Potentially. We don't know. But I'm going to give you some hints as to why it might be. And I'm going to tell you a few more things as to why this is a really big deal.
Okay.
So let's start with the really big deal.
Yes.
The really big deal is this. For the past 60 years, all the Alzheimer's related drugs or epilepsy drugs that were developed were tested in the real world maze.
Right.
The neurons in the real world behave completely differently than the way the neurons behave in virtual reality.
Okay.
I just told you one part of it. There is a lot more that I'm going to tell you. That means that when a human patient comes in and you ask that human patient to take a memory test or just ask them, is your memory better or not? It's a result of this drug. That testing is done in a different condition. Those patients are not swimming in a water tank.
Right.
So all the drugs that were developed to test how to cure fearful memory.
Right. Right.
We literally
that
were
specific
testing.
Context, right?
We were literally testing if the mice got better or not. By and large, there were other tests too, but this water maze test is the most common test.
Yeah.
We were testing mice to check if they remembered a horrible experience.
Yeah.
And they did well on the horrible experience too.
Yeah.
When we tested in mice in the same spatial experience, but the experience was positive, 60% of neurons shut down. And then the remaining 40% of neurons that were active, their maps were completely different than the maps you see in the real world. So that map that the hippocampus makes of space, which is the Nobel Prize of 2014, right? The Nobel Prize in Medicine and Physiology that was given in 2014 was for the discovery that here are these neurons, and these neurons make map of space, and that's where the memory is formed of everything, including conversations.
Okay.
Here we find that if you simply tested the hippocampus in mouse in the same condition as you would test in human being, the hippocampal responses are completely different. They have almost nothing to do with what happens in the real world. This is a major deal. So if now companies want to develop next treatments for Alzheimer's or epilepsy, I suggest that they test them in this VR system.
In the context of virtual reality?
In context of virtual reality.
But you're saying that they're behaving differently.
Mice are not behaving differently.
No, that's what I'm saying.
The neurons
are behaving differently.
That's exactly right.
Than in the real world.
That's
right?
exactly
so,
But the real world, the real world for mice were fearful. There's nothing wrong with the real world.
Right.
It's that the real world for mice was fearful.
Right.
Virtual world that we made several improvements. First improvement was it is not fearful. So a mouse and a human can be asked the same question. Go somewhere and you will get a reward.
Okay.
Because nature of question makes the brain solve differently. Not only that, you can say, well, in that case, don't use the water maze. Use some other maze and clean the floor.
Right.
When mice start to walk on the floor, Their nose is right next to the ground.
Mm-hmm.
There's no way to prevent them from sniffing the ground. They have these little whiskers.
Right.
With whiskers, which are very sensitive, they're touching the ground.
Right.
When we put the mice in virtual reality, there is no smells left. There is no whisker, there's nothing to touch about where they are going.
Right.
So we are literally...
You're isolating the spatial recognition, which is integral to the hippocampus.
Exactly.
But you're saying that these neurons, 60% of them shut down in virtual reality, right? The neurons in the hippocampus.
That's right.
But then they behave differently. What do you mean when you say they behave differently than in reality?
Very good question. And that brings us to our latest 3 papers that appeared in Nature, which is a big deal.
Yeah.
So the really cool part. So we then asked the mouse to say, can you actually form a map of space using only vision? Because if I were to ask you, Daniel, go there, tell me what's there, you'll mostly do it based on vision, unless the lights were out.
Right.
Mice, we think that they don't have good vision. Well, then why are we testing drugs in mice?
Mm-hmm.
So we first wanted to test, can the mice go somewhere for a positive reward, not a negative reward, using only vision, nothing else, no smells, no vestibular organ, no nothing. Amazingly, they can. Dead on, they can do this.
Right.
We look inside what the neurons are doing. They are doing something completely different. In the real world, when all the smells and textures are there, the neurons fire wherever there are these smells and textures. They hijack the neural activity. In virtual reality, that hijacking is removed.
Which is completely understandable because basically it's taking all these sensory inputs and then incorporating it into its memory of this experience through the hippocampus.
Exactly.
But you're saying through virtual reality, you take away all those other sensory inputs and you just say just vision.
That's right.
Just vision.
Just like a patient will be coming to a clinic or I'm testing somebody, and the way I'm going to interrogate a human being is vision and maybe vision plus audition. Now, we have auditory cues as well.
For Alzheimer's, it's strictly visual, spatial recognition, or is it just spatial recognition, which involves all these other things as well?
So as far as people test Alzheimer's patients in clinics, it's based on vision.
Okay.
Right? You just ask somebody, what did you have for lunch?
Right.
How do you go to your home?
Well, what I have for lunch also involves like smelling.
That's right.
Right?
That's right. So we can introduce those things. But right now, we don't want to do that because typically people will recall that based on the name of the dish or something.
Right.
But we don't want to go down the path. We want to go there, but not now.
But it's big that you can isolate.
That's right. We can isolate.
Right.
That's the exact deal.
Right.
So the one thing that we can directly compare is that now somebody can develop a therapy to say, here is a medication, you give it to a mouse, and that mouse, based on vision, can find where to go in order to get a positive experience.
When on this medication.
Versus
medication. If you're not on this
now
medication.
We can test the human being on the same medication for the same experiment, for the same question, and for the same answer.
Right.
Now there is direct translation. We don't have to worry about olfaction. We don't have to worry about tactile cues. We don't have to worry about whiskers. We don't have to worry about fear.
Right.
That's a big deal.
Yeah.
Not only is it a big deal, but it gets better than that. Behaviorally, we are testing in the same way. So you say, well, behaviorally we do fine. Aren't we done? Not really. You got to also look at what the hippocampus is doing. And the first question becomes, in virtual reality, all this learning requires neuroplasticity. Is neuroplasticity intact in virtual reality?
Is it intact or is it increased?
Or increased or gone down?
What's going on with neuroplasticity
What's going
in
on with
virtual reality?
neuroplasticity in virtual?
Okay.
So this was not known.
Okay.
So we have done essentially a ton of experiments over 20 years. Say when neuroplasticity happens, can we measure it in the live brain, not post-mortem and so on, at the level of single neurons, because neuroplasticity is at the level of single neurons. We can do fMRI, but that's across billions of synapses and so on.
Right.
We want to look at individual neurons. And we have developed solid measures to measure neuroplasticity directly in real time.
Right. And, you know, we talked about what neuroplasticity is in the last episode, but just real quickly, neuroplasticity is basically having increased connections.
Increased connections. That's
in
exactly
the brain,
right.
which can be pathological, right?
Exactly.
Like in PTSD, when you're constantly
That's
thinking about
right.
an experience,
That's
there's
right.
neuroplasticity that develops in the brain
That's
that
right.
causes you to constantly, think on
That's
that
right.
experience. But also, it can be beneficial,
That's right.
right?
That's exactly right. So we have done, this is a work that is a bit complicated to describe,
Right.
but understanding neuroplasticity and measuring it at the level of a single neuron in the live brain,
Right.
which is getting 40,000 synaptic inputs,
Yeah.
and there are other billion people freaking out in the brain.
Yeah.
It's complicated, but we have figured it out.
Okay.
And we can measure directly neuroplasticity of both kinds, which connections became stronger, because if everybody became stronger, once again you're headed towards epilepsy.
Right.
So there's a certain pattern of strengthening and weakening.
Yeah.
We can decode that. We can show that the right kind of neuroplasticity is happening. Not just neuroplasticity, not just more or less neuroplasticity, but the right kind, the right pattern of neuroplasticity is happening.
Are you talking about in the context of virtual reality?
In the real world, we had done this.
Right, in the real world,
we had done this, and many people, including our lab, had shown that when you go ahead and give a drug that blocks neuroplasticity, this measurement we did goes down.
Right.
When you give a drug that increases the right pattern of neuroplasticity, that too we can show at the output level at the neurons, so that goes up in exactly the way you want.
Okay.
And when you boost the neuroplasticity the right way, the behavior also improves. So
Right.
this is classic drugs which are well designed.
Yeah.
But this is a calibration to say, does this work as expected?
Right.
It does.
Right.
Now we take it for a ride in this virtual reality.
Okay.
And that's our latest paper in Nature. The amount of neuroplasticity in VR is double the real world. And the
Double
right
is
kind.
good.
Double is good.
Double is good.
Double is good, and double is the right kind. So we didn't stop there. We said, all right, double is good. We have a hypothesis as to why that happened.
Did you find where?
Yes, in hippocampus.
In the hippocampus.
In
Okay.
hippocampus,
Just
the
making
same neuron,
Right.
same hippocampus.
Yeah.
So there we got really excited. This is a big deal, right?
Yeah.
So then we said, well, it's just neuroplasticity. But at the end of neuroplasticity, there are all these neurons are complicated patterns.
Mm-hmm.
Do those complicated patterns that improve with neuroplasticity, do they predict behavior?
Exactly.
Well, that's another jump.
Yeah.
100%. That neuroplasticity causes the change in neural activity pattern in a complicated way. I can throw the words
Right.
and so on, but let me leave. It's all about the memory of where the reward is.
Okay.
Literally positive memory.
So what you did, what I'm guessing that you did, and maybe you did something differently, but you put him in virtual reality,
Yeah.
right, in the same exact maze as in reality,
Yes.
right, and then you noted the increased neuroplasticity in the hippocampus,
Yeah.
right,
Yeah.
and then did you put those mice back into the reality?
Not yet. Next experiment.
Oh, you have.
That's another one.
Have you
Wait.
done it? Or
We have done it.
Okay.
We are working on it, but wait till you hear the end of the story, and then I'll tell you.
Sorry, I'm jumping ahead,
No,
man.
no.
You got me really excited.
No, this is I didn't expect this.
Right.
Now, so none of this was expected. Not just me. There is no textbook that will tell you that these things will happen.
Right. This is something you're like, let's just explore
Let's
this.
just
Let's
be
see
careful.
what happens.
That's right.
Right.
Just be careful. Real world VR,
Yeah.
and all this starts to happen.
Okay.
So then, not only there is the right double neuroplasticity, not only is it the right pattern of neuroplasticity, but neural activity starts to predict what the mouse is going to do, all in the context of where the reward is. Can he go there?
Walk me through that one more time. Walk me through that
So
statement.
the task is...
the neural activity predicts whether he's going to be able to...
Yeah, whether he's going to be able to solve the task or not.
Okay.
So it's really...
Right.
So now we are not just looking at to say, here, I dump some, brain is a complicated place.
Right.
And I'm testing in water maze versus I'm testing in VR.
Right.
That's just kind of, as we say, mathematical. It's a low-dimensional representation.
Yeah.
At the end, you can say, okay, either he did it well or he didn't do it well.
Right.
But when we look at neurons, we can have a readout of hundreds of neurons, not just one or two.
Yeah.
Behavior-wise, either it did well or not is a binary, more or less answer.
Right.
But when we look at the neurons and we see neuronal activity shows plasticity that is predictive of the positive memory,
Right.
then you say, all right, this
We
is
might
not
have
just an
something here.
accident.
Yeah.
And
Yeah.
it's totally different than the kind of maze. So why did that happen? Why was neuroplasticity better?
Right.
We had two hypotheses. There could be 20, but we narrowed down on two.
Mm-hmm.
One thing is that when the mice were walking around in the real world, there were all these so-called distractors. right? He's going from here to there to get a reward. And on the way, there's some little smell on the ground.
Things smell, he hears something.
He hears something.
Right.
It's like me studying for an exam, and I either study in a quiet room versus 20 people are chatting around me.
Yeah.
We essentially did that. So we got super excited. If that is true, I should see even bigger signal at the level of not just single neurons, something that anybody can check.
Mm-hmm.
So what is known is yet another fancy thing that is known, and that's also clinical target, is that when I'm doing a certain task, if the hippocampus is engaged, the hippocampus develops this rhythm called theta rhythm.
Mm-hmm.
It's one of the oldest discovery.
Yeah.
You can't hear that theta rhythm, but hippocampal neurons become highly rhythmic.
Mm-hmm.
And if somebody has some disease, some of these are Alzheimer's and so on, but other diseases too, the theta rhythm gets weaker. So many pharmaceutical companies have invested to, instead of just looking at behavior, to say, let's look inside the brain. Single neurons is hard for pharmaceutical companies, but they can look at this theta rhythm. Theta rhythm is a major target to say if somebody has memory problems or learning and memory problems or ADHD problems or any of those things, give them a drug that boosts theta rhythm, the brain's internal rhythm. If you improve brain's internal rhythm, lo and behold, the memory gets better.
Right.
So you can guess what happened. We put the mouse in the virtual reality back to back with real world. In order to control everything, we did everything the same. The task is very simple. Just walk in a straight line. Nothing fancy. Don't even have to remember anything.
Mm-hmm.
Just walk back and forth, get a bit of reward, nothing else. The theta rhythm as well doubled in virtual reality.
Mm. So you've got, just to make sure that we're on the same page and to summarize, right? You put these mice in virtual reality, right? You note that there's a 60% decrease in neural activity in the hippocampus.
Right.
That 40% is acting differently.
It's predictive of behavior.
Is acting differently. It's AKA it increases that 40%'s neuroplasticity.
And it makes it better memory of the reward where the reward is.
Right.
It makes that better.
Right.
And then
increase theta.
Increases theta.
And then you put them into the real world.
Yeah.
And then behaviorally in the real world.
We don't know that yet. We don't know that yet.
All right. Okay.
That's a harder problem because that's a longitudinal study.
Right.
And as you know, longitudinal studies are tricky.
Right.
Because you got to control for this and that and so on.
But you didn't just try like right afterwards. You didn't just try to put them in there?
We did. It gets really interesting. It's a long story.
Sounds great. Yeah.
Absolutely. So then let's go back to the point that you made earlier. Whatever experience that I have and the pattern of activity and so on, that needs to be consolidated to neocortex for to get integrated into the memory patterns. So now what we are doing is we are measuring what happens to that memory that was formed. That was all the good things seemingly were going on.
Yeah.
I'm not saying these are good things necessarily, but as of now, they are good things. They may be a good thing for Alzheimer's patients, these things we mentioned. They may be a good thing for epileptic patients. But these things may be bad for somebody who has schizophrenia.
Right.
Because they already have delusions. And now they start to mess with those things that can be bad. Right. So I'm not saying that virtual reality, 100% use it at home, is a cure-all for everything. No.
Right.
Stop right there and there.
Right.
I'm not saying that. I'm saying there are lots of interesting things going on that show promise that VR can be used for accurate early diagnosis of neurocognitive disorders.
Right.
Treat development of accurate therapeutics so that phase 1 trial to phase 3 trial translation chances are greatly increased.
Right.
And potentially testing if neuroplasticity is better and the theta rhythm is better, does the memory improve in the real world? But we also, like any drug, we also need to test, does it have any other weird side effects on a small population of people or maybe large population? We haven't done that work.
So
that's what I want to convince NIH. We should do this. We should not treat VR as just a little TV.
Right.
The VR should be treated in the same way as Tylenol is being treated.
Right.
To say, no, this does funny things to the brain.
Yeah.
And right now what we have discovered are really huge whopping things.
Yeah.
So before tons of millions, right now the average age of a VR user is like 15 years.
Right.
And many parts of the brain have not even fully developed.
Right.
So we want to treat VR as carefully. And it can be done rather easily. It's not complicated.
Yeah.
We can do it. We can even build a VR, as I mentioned, that is much better than the commercially available one. So there is real potential for developing VR that is actually good and doesn't cause harm.